Psychological disease can show up in a lot of ways. It can show up emotionally, such as anxiety or depression, or more concrete feelings such as fear, anger, shame. It can also show up in addiction. So a lot of times people become addicted to things because they have trouble more connecting and staying with their true selves. So they constantly have to kind of run away from ourselves. I would say that's a general pattern in human behavior, is people not being okay with the truth of their experience. So they're constantly trying to escape it, whether it's through addiction, whether it's through constantly working. Could be a whole bunch of ways that people can constantly avoid actually trying to being with themselves. And I think that's what a good thing with therapy is it provides a place where people can actually slow down and learn to connect with themselves instead of constantly, escaping whatever that root feeling is. It's providing a trusting environment where people can actually be able to feel like it's okay to feel these things and be slowly get to better terms with that experience themselves. So I often think about therapy as very acute medicine, right? It's like a specific place that we meet, once a week or every 2 weeks or whatever, where people can slowly learn to connect with themselves. And that becomes, the base experience where hopefully they can find the confidence to be more their true selves in real life. Well, I'd say that a lot of clients come because they're struggling with addiction. Of course, the main addictions that we think about are substances. Pornography is now, unfortunately, addiction that's growing. But then there's the more less subtle ones, such as addiction to one's job. And it just generally, you can think of addiction as an avoidance pattern because people are having difficulty just being with themselves. They're constantly needing something externally to distract them from themselves. So we work very behaviorally with that. Of course, goal setting, specifically what can we do to try to strategize to reduce that pattern, that compensation pattern. But then through that, hopefully providing a place where people can connect with actually what the actual root wound is. As we were talking about shame before, oftentimes when we feel there's something wrong with us or we're bad, we're constantly trying to get away from that. So therapy is a place where people can slow down and work through those base difficulty feelings. The addiction, the actual substance, can actually help people escape themselves and they're okay for a bit, right? But it eventually causes the dysregulation. Usually what they're escaping usually will come up. I like to think our psychology is trying to heal. So whatever the dis-ease is usually comes up in a way because it's trying to actually evolve. It's trying to actually get to a completion. So people's addictive patterns or avoidance patterns can work for a while, but then the totality of one's psychology will manifest whatever the actual reality of the disease is. And then hopefully, I guess there's two ways that can happen at that point. People often polarize even stronger to a stronger avoidance pattern, or hopefully it's an opportunity to be able to work through whatever the root issue is. And therapy, I think is a good place for that, so for people to be able to calm down and actually start to make friends with whatever the original wound is.